Senator Alsobrooks.
Thank you so much, Mr. Chair. Good morning, Dr. Monarez, and thank you so much for being here this morning. I have to tell you, we have over the last 6 months watched this administration in horror, watched it dismantle our public health and research system, all while touting what they have called, quote, their effort to restore gold standard science. And I don't know what focus group came up with that title. It's untruthful. Because the fact is, cutting $12 billion from NIH research for critical cures is not gold standard science. Looking to cut $18 billion more will not deliver for us gold standard science, and firing 2,400 scientists and public health workers from the CDC will not make Americans safer from the threats of outbreaking and emerging diseases. Firing experts they have fired that provide recommendations for vaccines and sowing doubt about the science behind vaccines, I believe will lead to more Americans dying. Shutting down rural hospitals, throwing them off their insurance. I mean, it's just one thing after the next, which I think will not only make us sicker, but also cause us to die. This past week, you expressed confidence in Secretary Kennedy's new picks for the Advisory Committee on Immunization Practices, known as ACIP, saying that they were all credentialed scientists and medical doctors. And that same day, the committee's own chairman called for the delay of the committee's Wednesday meeting, saying that the new appointees, quote, do not have significant experience studying microbiology, epidemiology, or immunology. And so my first question for you is whether you believe that the 17 members that this administration fired from the Advisory Committee on Immunization Practices, in fact, lacked qualifications.
So look, part of the Secretary's vision in restoring public trust is making sure that the American people can be confident in the way that the evidence and science are driving decision making. The Secretary made a decision that resetting the ACIP from the 17 previous members to a new cohort of members was going to be on the path of restoring that public trust.
So I respect that you're not able to say yes, that they are qualified individuals. So I'm going to ask you just another question about it. Do you believe that the 17 individuals who the Secretary, bless his heart, appointed, have conflicts of interest that undermine their independence?
The 8 members that he appointed.
The 17, yep. Do you believe that they had conflicts of interest that undermine their independence?
You're talking about the previous 17.
The new.
The new.
Yes.
New. Okay. He's only appointed, I believe, 8, but now I understand that it's 7 members. To participate in the ACIP meeting, those members will have needed to go through an ethics approval process and declare conflict of interest. And the Office of Government Ethics will evaluate whether or not those conflicts of interest are directly related to the information that they're going to be receiving and evaluating as they conduct their business at the ACIP members. If the Office of Government Ethics makes the determination that the conflict of interest are in fact directly related
and
to.
Doctor, let me just ask you a specific question because I see the time tolling. Would you say that an ACIP member that made money as an expert witness, for example, in litigation against a major vaccine company would be considered a conflict of interest?
So that individual will have had to declare that during the vetting process by the Office of Government Ethics. And the Office of Government Ethics will make an evaluative judgment to determine whether or not that participation and that payment is directly in conflict with the ability of that ACIP members.
Let me just say this. So I know that it is not allowed, that generally these members are not allowed to serve as expert witnesses in vaccine litigation, yet Mr. Koldorf, who was appointed, he's a person who recently served as an expert witness for plaintiffs who accused Merck of concealing the risks of an HPV vaccine. So that would be, I believe, a conflict. Let me just ask you something else really important. You're a scientist, and I know that you believe, I want to just ask you whether you believe that fluoride is safe and effective when used appropriately.
Fluoride is an important component to oral health, and there are various aspects of using fluoride to improve oral health. A direct application can be very valuable.
So let me just say this. So I'm so glad to hear that because the secretary has directed the CDC to stop recommending fluoridation in communities. I'm very concerned about this. I know you are one of my constituents. I'm very happy about that. And your community has fluoridation. And so I just want to ask you a last question. Do you believe that the water in Potomac, Maryland, for example, is safe for families? They have fluoridation there. Is it safe for families, the water in Potomac, Maryland?
I believe the water in Potomac, Maryland is safe.
Thank you so much, Doctor.